everybody. We're joining Christine Sevier. She's with Creating New Hope. And I'm Shannon Reese. I'm your host with Alameda Senior Transitions. And today we're going to be talking about senior living advisors and what they can do for you, what they can do for your loved ones. And I'm going to let Christine tell us all about it. So Christine, why don't you start with a quick bio on who you are, what made you get into the business, that kind of thing.
Yep. So my name is Christine Sevier. I have a background in providing intensive case management. But I didn't get into this business until I became the special needs co-conservator for my grandmother who had Alzheimer's. And I thought, of course, Grandpa, I'm equipped to walk alongside you during this. And boy, was I out of my league. When he passed away and I had to become her caregiver overnight and take care of all of her care needs, manage the medical documents, make sure the appointments are getting set, make sure caregivers are coming in the house, showing up on the weekends, the evenings. That's when it got really tricky. And towards the end of her life, I didn't want to, most people don't imagine themselves placing their loved ones into any type of assisted type living. Most people want to age in place, as did my grandmother. But it literally just became too labor intensive to where I couldn't physically do the job and pick her up on my own. I couldn't ambulate her. She needed a lot more skilled care and I was unqualified. So I had to look for a really good, smaller setting for her because at that point she was completely bedridden, needed full support. So I went on a hunt and really tried to deep dive and take a look at what were the best places that had really good transparency records, didn't have a history of bed sores, personal rights violations, or skin breakdown, because like I said, she was bedridden. So once I did the deep dive and started looking back then, you would have to go down to Clay Street and pull a few records for a few facilities. I found a really, really good place and they had like impeccable records since 1993. And I ended up placing my grandmother there. And at that point, hospice said 6 months. 6 months, Christine. She's got 6 months. No, she lived in that care home 2.5 years. And they took impeccable care of her.
Wow.
Her sheets were changed, her nails were painted, her hair was washed. And this is somebody that's no longer communicative, completely bedridden, couldn't even tell you their needs or wants or desires. So I had a really good experience at the care home that I found. And then I kind of just stumbled into the business. I went back to work after my grandmother passed and everyone said, "Hey, can you help me find one of those care homes like you found your grandmother?" So that's kind of how I got into this accidentally.
Well,
Or I like to say the universe put me here.
Hey, that's a great story. For those of us that don't have a medical background, what are the kind of questions, like when you said something about skin eruptions or skin degradation?
Yep. So skin breakdown, especially if someone is incontinent and they're using adult briefs. One of the most important factors that I learned, and I don't even have a medical background, I literally had to learn how to become a caregiver overnight on the fly. And I thank God for those hospice nurses and the hospice care managers and the volunteers that really taught me, the CNAs and the caregivers really taught me about, making sure to keep skin integrity because that will lead to infection, potential sepsis, and pain, right? That's not how you want to go. So it was so important that my grandmother was dry. We used, fancy skin barrier creams. And, changing a baby in bed is easy. Changing an adult in bed, that's a skill set. And I about lost my mind on multiple occasions because I had no idea how to do this. But you get a skilled caregiver in there, they're doing these fancy roll up of the brief and they have a pull sheet. And it's magic.
Wow, that's really cool story. So you learned about medical stuff on the fly.
Yeah.
And then, so it sounds like to keep the patient dry saves you from all kinds of problems.
Yes.
And
yeah.
So then, well, okay, let's say that I have somebody who needs to put someone in a care home for whatever reason that is. what is your focus? Do you have a geographic focus, or do you have a specialty, or explain a little bit more about that, or maybe you've already answered that.
Well, really, it starts with that initial phone assessment. So I'm figuring out, hey, what do they still ambulate? What kind of things or communities might bring them a sense of joy and purpose? Are they still active? Are they going to participate in those activities and the rummy cube games and the great course lectures, or are they more isolated and want to be on their own? Or I always tell families too, if they can no longer ambulate or advocate for themselves, it really is time to really look at a smaller setting if you're going to be leaving the home, just because of the caregiver to client ratio is a lot better in the smaller settings.
And again, just to clarify, ambulate means to move, right? Or what does it mean?
Yes.
Okay.
Yeah. So
Okay.
if you
So
can't
lack of movement.
walk on your own, it's time, and you need standby assistance, someone next to you. Let's say you have Parkinson's or you have some um, mobility issues and you need that support so you're not a fall risk.
Mhm.
Look at a smaller community so there is that support available.
That's a great.
Unless you're super sharp and you have the ability to say, hey, boop, I need to get up. Someone come to my room and
Okay.
help me.
And so typically, do you just deal with people here in the Bay Area, or do you actually do like these kind of phone conferences like we're doing, like with people around the country, or what's your typical client?
Actually, the Bay Area, Greater Bay Area, I like to tell people. But if somebody calls me, like I have a lady that's calling me that I'm working with right now out of Palm Desert. And I'm really just like her Sherpa walking alongside her virtually because I can't be there. And I have an entire checklist and a whole entire process of here's the questions you should be asking, here's the things you should be looking for. So I'm that first call um, in this journey.
Journey. That's a great way to say it. And then, so that how do people usually meet you, or is it you explain your typical? How do you come across people?
I get a lot of referrals from just previous past clients. I do a lot of educational seminars on teaching families how to do the deep dive and look at the data, look at the transparency records. What are some of the questions you want to ask? What are the residents' rights in these communities, especially as we're coming out of COVID? A lot of visitation things had changed, so just staying on top of regulation. I am also a licensed RCFE administrator, so a lot of the directors, executive directors for these larger facilities, you have to have this RCFE license. I keep that license just so I can stay on top of what's going on in the industry, what are the best practices, what are the new regulations and protocols.
Okay, I'm sorry. So tell me what an
Oh,
RCE.
it's RCFE license. It's a residential care facility for the elderly license.
Okay, so then that kind of gives you credentials to talk to these folks.
Well, at least to know if you were going to be an owner and operator of one of these communities or a director, you have to have that license.
I see. Okay. And like we had my mother-in-law who had to go into a care home, and we ended up, because the hospital, when she was discharged, did not give clear instructions on her diet.
Mm-hmm.
Became a fight with the nursing home because they were going on the incorrect orders. How what's the how do you resolve like what seemingly insignificant things turn into big problems? How do you
And so
do
here's
that?
the thing. So I have a next step document. And
Okay.
basically, what I say in that next step document, like I'm the Sherpa in this elder care continuum.
Mhm.
So I'm making sure that those families have that dietary constraint as well as over the counter medications listed. Because here's the thing, California is a very strict state to live in. So let's say, you know what, your mom uses A&D ointment for her hands, or maybe she has eczema or something, and she doesn't need a prescription for this. You just go buy it, $7. Well, in the licensed assisted living or residential care setting, you actually have to have even over-the-counter medications listed in your chart and on that 602 physician's report, even if it is dietary needs. Let's say if it's a chopped, soft mechanical diet, That has to
Mhm.
be listed somewhere. Let's say your loved one has dementia and they have to take these high blood pressure medications, but they're fighting you on it and they don't want to swallow that medication. So you crush it, and that's what you've been doing at home for years. Well, guess what? Unless the doctor writes an order for that, you cannot just move mom to that community and say, oh, no, 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 this is how we do it.
I see.
No.
So in other words, it's like well-meaning regulations sometimes get into the practicalities of how things are done.
Yes. Yeah.
Okay. Okay. But without those regulations, then people could be abused, I guess, to potentially.
Yeah. Yeah.
Okay. So it's a weird kind of gray land that I'm glad you've got that next step document to help people avoid that. Um, okay. Well, then let's move on to, I know that you're here to help us, but just like anything else, it's a business. Can you explain to people how you would be reimbursed for your services?
So I am reimbursed. I don't charge families a dime, not for any of my consulting time or anything. I am reimbursed by the communities I contract with, much like a realtor. The communities pay me.
Okay. And that's because in the end you've obtained them a new person to use their
Correct.
services. Okay. All right. Fair
Correct.
enough.
And you know what? It's really communities love working with referral agents like myself because it's a skill to appropriately place someone
Mhm.
in a setting that's going to meet their needs, their current and their long-term needs. So, for example, let's say if I have a gentleman that's really big, 6 feet, 240 pounds,
Mhm.
and we know that he has let's say he has some back issues and he's eventually going to be immobile. Does that large community allow for a Hoyer lift? Do they allow for a two-person transfer? If they don't, we have a few communities that we need to eliminate because I'm looking at the full spectrum of life and as well as affordability. Right now, I have a lot of fiduciaries that are reaching out to me,
Mhm.
just with the changes in the market and folks' retirement. They're saying, hey, you know what? Dad's staying in his room at the large assisted living all day. He's not participating in all of the available activities. It's time to move him to a smaller setting and save money.
Okay.
I have clients that are paying $27,000 a month at a
Wow.
large community because they need that standby assistance. I help find a residential care home that's 2-to-6 ratio, and they're paying half that now.
Okay. All right. Well, and I was listening to you. I was thinking the reason they would probably love talking to you is because you speak their language, like,
Yeah.
ambulatory, the
Yeah.
various licenses and all that, so that it's like talking to a mortgage broker and a realtor so that
Yeah.
they understand each other. Okay. That's great. And then how many different types of other professionals that relate to a person going into the home do you typically deal with? Like you were talking about a fiduciary. What are your other typical people that you're dealing with, other professionals that kind of help you take care of the whole person, we'll say?
Right now, it's a lot of mobile physicians that will come out. So I'm connecting families with mobile physicians that will come out and do that initial assessment.
Okay.
Mobile podiatry, a
Okay.
lot of home health agencies, because what I also do connect folks with is, let's say, somebody has a situation, they're like, look, mom only has XYZ amount in her pension or out of her 401k.
Mhm.
We need to really be conservative. Maybe what they need now is not to go into a larger assisted living and go there, but maybe they need to connect to a reverse mortgage specialist and see if they can stay in the home and get away with 4 hours a day of care for a
Mhm.
couple more years.
Okay.
So I'm really having those strategic long-term care conversations and really connecting all of the families to all of the moving pieces.
Okay. All right. And then, I think you and I had talked before, but why don't you explain how you are viewed as being transparent with people, how
Mm.
they can learn? Like, in other words, you're opening their eyes rather than being just their guide. You're also helping them understand the system.
So a lot of families will look online reviews, and they're trying to get a sense, especially what am I, a Gen X or what am I, a Gen Z? I don't know what generation I am. I'm 40. So
Uh,
we're data driven. We
I-
want to know the
yeah.
ratings, we want to know the score. So what I'm really proud to say that I have developed with my business is anytime families are receiving a referral from me of a list of communities that we're going to either tour together or they're going to tour on their own, I am giving them a digital link to each community's transparency records from the Department of Social Services. So you can look right there, have they been compliant with the new COVID protocols? Do they have a history of bed sores or personal rights violations? So how many complaints have they had logged against them? All of that data is going to be there. And a lot of families are grateful to have that information.
I was going to ask you, you keep talking about this is the second time you've mentioned personal rights. Is it almost like you've gone into another world once you go into the home? Is there like a restriction or a difference in what you would call personal rights, or am I misunderstanding?
No. There's a document that it is called personal rights for individuals living in a residential care home. They have the right to be safe. They have the right to have confidentiality in their treatment.
Mhm.
They, of course, are accorded dignity in their personal rights. But one right that I really do like in the personal rights is they also have the right to um, create a resident council. So
Oh,
they have a right. Let's say they're not happy with the chef and they're like, look, you know what? This chef is not working out. We do not like the tomato soup on Sundays. Let's establish a meeting about it. Well, the residents in any community can form a council and put their requests to the director of that community. Um, or let's
okay.
say, you know what, hey, we don't like our activities. We'd like to see XYZ happen in our community. They have the right to say what they want to happen in their community.
So I've got a question for you. Do you know if that sounds like a very California kind of specific thing? Do you know if that's across the U.S. or do you have any idea? Did I lose you? Did you hear me?
You, the first part I didn't hear.
Garbled. Yeah, I was going to ask you. Is that sounds kind of very California to me? I'm
Oh
originally
yeah,
from
that
the
is
East Coast. Yeah, so I didn't
definitely
know if that was
California.
like a across the U.S. kind of regulation or if that's a California only kind of deal.
That's California.
Okay, well that's a good thing. All right, so let's talk more about like everybody wants to hear the latest tips and tricks. So on that kind of thought process, what do you see as being the latest developments in nursing home care or issues or things that are driving people to you and they're just really distraught? What are some things that you're finding that it's becoming a thing that maybe you didn't notice in the past?
You know what? I'm seeing a lot of communities that before maybe they were reluctant to technology and
Okay.
having those iPads in the rooms and Zooms and FaceTime. That communities are opening up now to technology since COVID. They're willing to do a virtual tour. For example, if I have a client that's out of state, or maybe there's multiple siblings that want to be a part of this process, but they can't come out here,
Mhm.
we're jumping on a Zoom with the director from that community, and doing a virtual tour.
So it's
They're
almost
using,
more so positive stuff, not negative.
yes.
That's
Yeah.
great. That's really great. Okay. And I guess also the community must be realizing that that's not a negative for them, so therefore they're open to it, right?
Yeah.
It's not hurting
Yeah.
them. Right. Okay.
Yeah.
And then do you see any future issues to solve, or do you think these are kind of universal problems that will always be there with various technologies to solve them in the future?
I think I'm seeing a lot more people younger,
Hmm.
um, 60 being diagnosed with dementia and
Oh,
they can't be home alone. I'm seeing a lot more of that. And um, there's not too many communities that will have truly high functioning memory care communities. You're
mhm.
kind of mixed all together. There are
Oh,
very few communities that say, you know what, we'll have this side of the building with residents that are higher functioning and, the other side, not so much.
okay.
There's some communities, again, utilizing technology, a band or a bracelet or like a lanyard, and it's called a Wonder Guard. So
Okay.
they may let somebody that has mild cognitive impairment on their physician's report move into an assisted living community and just utilize that Wonder Guard as long as they're not an elopement risk or they're going to walk out the door, at least the door will be alerted with that wander guard. So I'm hoping that communities will do more of that and be open to that
Right.
because, I have scenarios where really young folks can't stay. I had a client that almost blew her house up, left the stove on,
Oh, wow.
um,
Hmm.
you know, and
Yeah.
it gets difficult. So I'm
Well,
seeing a lot more dementia.
oh, okay. Well, let me ask you this because, and again, I'll give a personal story. My mom, my stepfather, he ended up with Alzheimer's. This went on for 8 years. The last about 3 years, I think he was in the home. This was in Alabama, so not in California. And she was paying, I think, $7,000 to $9,000 a month out of pocket. And over 2 or 3 years, eventually, she kind of had gone through their money,
Yeah.
and there was shame around using in Alabama it's called Medicaid. I think in California it's
Medicare,
Medicare. Oh, it's the same thing.
Medicare and Medi-Cal.
Medi-Cal, got it. And then for those that aren't familiar, that are about in our age bracket, explain the difference between Medi-Cal versus Medicare. And I know one's California specific, and Medicaid, it's called Medicaid.
So, yep.
Yeah,
So Medicare is your medical retirement benefits when you're what, 67 now? Didn't they
I think
bump
that's
the
right.
age up? I
Yeah.
think it's 67,
Mhm.
which is going to pay for your health care, not your long-term custodial care. And
Mhm.
even Medi-Cal,
Mhm.
if you are 120% below the federal poverty line,
Mhm.
and we're talking like in California, that's what, 1,800 bucks a month,
Mhm.
maybe,
Mhm.
maybe. Then you can qualify for Medi-Cal, and then there are two programs that are a stopgap. One of them is called IHSS, In-Home Supportive Services, and the other one is called the Assisted Living Waiver Program.
Okay.
Years wait list, years. So it's very important for families to get in touch with me because I see a lot of families, well, I'll just spend down all of the assets
Mhm.
and I'm going to apply for this program.
Right.
And I always say, hey, go look at the CANAR website.
All right.
Well, CANAR, it's California Nursing, I forget the acronyms.
We'll look it up and put it
Yeah.
out. Somebody. Yeah.
So look at the CANAR website. They'll show the income limits. And I know income limits changed as of July, but still you have to be extremely poor
Mhm.
to receive any benefits. And
Okay.
even if you were able to get those benefits in California, there are very few providers that accept the assisted living waiver program. So you may be forced to go to Fresno or Paradise or wherever that available bed is.
I see. So it's a double whammy then. So yes, they technically do it, but then therefore no one does it. So you're still left with a
Yes.
quandary, I guess you'd say.
Yeah.
Okay, that's good to know. Um, okay, so basically it's hard to qualify, and then it's hard to find somebody who will actually take you in California with
Hmm.
with a limited
Yeah.
income or Medi-Cal or whatever you want to, if you're in that boat. Okay,
Yeah.
all right. Well, that might be one reason to retire elsewhere if you can't afford it, right? Unfortunately.
I tell my
Oh
dad all the
boy.
time, hey, you didn't prepare, you're going to Mexico. I hate to
Yeah,
tell him.
exactly. That's my wife's biggest fear is like we're going to be drooling in a corner somewhere,
Mhm.
that because such poor, quality of care or whatever it is.
Yeah.
So,
And you
okay.
know what? The best long-term care insurance policy you can purchase
Mhm.
is a gym membership. Stay mobile, stay healthy. I'm telling you right now, all the clients that come to me, they come to me because they didn't take care of their health now. Broken hip, high blood pressure, renal failure,
Okay.
dementia. Yeah, I mean,
That's
stay
I
active.
love that. That's a great best tip. Okay.
Yes.
Is a gym membership. Okay. All right. Well, anything else you want to add? And, um, because what we're going to be doing is talking with Christine probably in the future about other topics. But is there anything else you'd like to tell the audience that could help them?
If you're in need or if you no longer like the caregiver that you are becoming and you are stressed out, it is time to call me and let me help you come up with some strategic plans. Christine Sevier, Creating New Hope, taking the guesswork out of elder care.
And what's your number there?
925-495-0330, or you can check us out on the web at creatingnewhope.org.
Okay, great. Thank you so much for joining us, and we hope you guys have all received something from this program as well. Thank you. Bye bye.
Thank you.